I'm going to be recording it, okay?
Okay.
Okay, so I'm going to ask some questions about your job as a forensic nurse. I wanted to ask what parts of the health do you monitor for the population that you work with?
So it's a complete head to toe medical forensic exam. So I don't know. It's a complete exam. We're looking at all of their skin from their head to their toes and assessing their psychosocial needs as well.
Okay. And is there any nursing diagnosis that you make on the field or anything that you
No,
investigate that goes beyond
we
rape?
never use nursing diagnosis after you graduate from nursing school.
Yeah, that's true.
Never again. No care
Um,
plans.
oh yeah. Okay, so is there anything like you look into though specifically as a like what do you look for? What do you investigate?
So we're looking at all of their skin from their head to their toes for trace evidence, injury, and documenting and collecting any of those things.
Okay, when you go into interview or examine one of these patients, is there anything you consider before you walk in and speak with them before the
Well, we
exam?
do get a brief history about the crime and about what happened to their body. So obviously every case is different. It's a case by case basis. So sure, sometimes.
Okay, and then when you walk in to do an exam, how if you can just give me like a quick little rundown of how that would look like. So you get the brief scenario, and then how does that go?
So yeah, before we arrive, we get a brief scenario, and then we do a full, intense interview with the victim, and then gain their consent and go in to perform evidence collection and examination. So again, just a complete head to toe exam. I look at all of their skin from their head to their toes, and I collect evidence based on where the history dictated that the crime occurred.
Okay, and then is there anything that you educate them on, or kind of just like like therapeutic, conversation wise?
So we always use trauma informed care with all of our patients, um, as far as communication, and um, nothing in there or that occurs during our examination or interview is a secret from them. We tell them everything that we find as a result of the exam and everything that the exam entails. And they have the option to consent or decline to any part of the exam.
Okay.
And then as far as education, of course, we provide education on the care of any injuries that are specific to them and to STD and contraceptive medications.
Okay, and then for community partnerships, do you link them with any resources?
Yes. So California Penal Code requires that an advocate is called out on every case, and they are present on every case and provide them with crisis intervention at the time of the exam, as well as follow-up counseling.
Okay, I'm not sure if there is any, but is there any specific protocols that you strictly follow when you're working with the victims?
Yes, we follow the California State Protocol for sexual assault.
Okay. And let's see. What does your, I mean, if you could just give me a quick, I know you're real busy. What is an example of a question, or what does your report look like?
So the report is created by the state of California. So it's a standardized report. It can be found at the California Clinical Forensic Medical Training Center. You can look it up online. And it's a CALIMA 923 report that is used on every adult case in the state of California to record exam findings for sexual assault. It's an electronic form now. It used to be 8 pages. Now it's probably closer to 12. Just depends on how much injury there is and
Wow.
How much there is involved in the case. So it could be longer, but it's about 10 to 12 pages now. So part of the form is the consent that the patient agrees to or doesn't agree to. And part of it is the interview, the intense interview that I mentioned. And then the rest of it is the documentation for injury and evidence collection.
Is there anything that you follow up on after that exam and interview is completed?
Like at a later date?
Yes.
Not usually, no.
Oh, that's more of like maybe the law enforcement, right?
Yeah, so law enforcement, of course, is going to be launching an investigation, and the advocates are going to follow up to see if the patient wants counseling. Traditionally, we don't have any other further interaction with the patient unless they would require. If they had really significant injury, we might bring them out back for a follow-up exam, but that doesn't happen very often.
Okay.
Most of our patients have little to no injury and do not require that. The only other thing, we do have an HIV PEP coordinator that follows up with HIV PEP, but it's typically just over the phone.
Oh, okay. And just my last question for system management and research. Is there any gaps that you recognize that maybe the community needs to address with the population you work with, or there's any data that you believe that the public health needs to be met?
Oh, wow. We don't have enough time to discuss the gaps our society has created for rape victims, unfortunately. That's a great question. But of course there is. That there's more than we would ever have time to discuss because of, the placement on the lack of services for these people and the lack of compassion and the lack of trauma-informed care is huge.
Wow.
And so, there needs to be more education. There needs to be more people that start the conversation believing these victims. And there needs to be more follow-up care for them in order to sustain long, happy lives where they aren't re-traumatized by our justice system.
Thank you so much, Jennifer. That was a great interview. I learned a lot, and I appreciate your time.
Oh, no problem. Sorry it took me so long to get back to you.
No, you're fine.